Hey guys, in this video, I'm going to break down exactly why Medicare Advantage plans are so popular, and then the main points that you need to understand about the Medicare Advantage plan that you're looking at, and then the questions you need to ask yourself before you enroll into a Medicare Advantage plan to ensure it's the best fit for you. All right, guys, let's cover some of the main benefits or the features of a Medicare Advantage plan. Again, a Medicare Part C. One of the big things a lot of people love is a zero premium or low premium monthly. I like to say, if you have the plan, you park it in your wallet, and the only time you pay is when you pull it out and you actually use the plan. So Medicare supplements is you pay a premium monthly, and then you access care and you don't really have cost share, copay costs. Medicare Advantage plans, we're going to cover here in just a second, have small or marginal size copay costs that you may have, but the plan itself usually is zero or very small premium. You park it in your wallet, you park it in your back pocket, and you don't pay anything unless you access care. So one is I pay monthly and I don't pay when I access care. One is I don't pay monthly, but I pay something when I access care for certain things. And those things that you're going to be paying for are going to be like Part A hospitalization items. That's going to range anywhere from $200 to $350 copay per day. Usually it's going to range between 1 to 6 days on average. Most plans are 1 to 6 or 1 to 5. Part B costs, they're going to range anywhere from $0 up to a $350 copay. Now, to simplify this, your doctor visits, which most of us are most concerned about, like primary care doctor, those are going to range anywhere from about $0 to about $15 copay costs for most plans that are available in our markets. And then your specialist copay costs can range anywhere from about $30 to about $50 copay costs. So you pay the copay when you go in, you show your card, pay the copay, and then everything else is covered by the plan. Now, when we get into larger items like outpatient surgeries or maybe MRIs, high diagnostic CAT scans, PET scans, things like that, we may be looking at a higher dollar copay cost up to maybe about $350. That is a national average. Most plans that we enroll people into range anywhere from $0 to $150 in certain markets, or all the way up to $350 for those larger type outpatient surgeries and services. And again, the hospital, inside of the hospital, is a per day cost up to about a 6-day average. So there's no Part A and Part B deductibles, or you may be in an area and you're like, Kelby, I caught you. There is a deductible on my plan. Why is that? Well, starting in 2025, there has been some Part A or Part B typically are deductible amounts that you're having to meet. Usually these are less than the hospital copay cost total. So usually anywhere from $0 to about $350 cost if you do have a deductible. But most of the plans and areas that we put people on Medicare Advantage plans have no Part A or Part B deductibles, where original Medicare does. They have dental, hearing, vision, and over-the-counter gym memberships and more. So this is like something I tell people, and you've heard me say this in previous videos. We never enroll people based on dental, hearing, vision, over-the-counter benefits. We base our enrollments in Medicare Advantage plans on your doctors, your specialists, your hospital, and access to care that's most important to you. But you know what? Having a dental benefit of $1,000 or $2,000 is a huge benefit. If it has hearing aids, usually there's allocated amount to cover hearing aids or a copay amount that you can have hearing aids. And usually it kind of works like $350 for a standard hearing aid up to maybe $1,000 or $1,200 for a deluxe hearing aid. And usually it'll cover 1 to 2 per year. Vision is going to allocate typically a dollar amount that could be up to a $200 or $300 eyewear allowance. Again, it's all depending on the plans in your market. Over the counter, this can range, and this has dropped. Some of these benefits for you guys in this year in 2025, you've seen a reduction in your benefits. And the reason being is that most of these plans cover prescription drug plans that are MAPD or prescription drug benefits built into the plan. Because of the Inflation Reduction Act, it's reduced the cost of your medication cost out of your pocket, what you're going to pay. It actually has made these benefits degrade. So coverage has increased for prescription, which I think is good. But it's degraded some of these other benefits, and people will say, my OTC benefit used to be $125 a quarter. Now it's only $50 a quarter. And I go, well, your medication costs dropped and it's capping out at $2,000. So There's kind of an exchange, but some of the benefits that have not really changed is like gym memberships. For me, I pay $60 a month for a gym that I go and work out to weekly. If I turn 65 and I choose to enroll into a Medicare Advantage plan, then I'm going to probably have a gym membership that's zero cost. And there's a huge access on most Medicare Advantage plans. They have a third-party gym membership benefit that's built into the plans, and you have access to numerous gym memberships around the area. And there's more benefits above and beyond that. These are the most common ones. Prescription drug coverage can be included, again called a MAPD plan or a Medicare Advantage prescription drug plan. There's a play on words. It's an acronym that you hear people like me say. Max out of pocket on these plans are going to range from $3,000 to $6,000. So anything that you pay out of pocket goes towards this max out of pocket. And here in a second, I'll draw just a simple picture of what that looks like, but you'll never pay anything above and beyond that max out of pocket. And that is regulated by Medicare. There is a max out of pocket that Medicare regulates now. It's a little over $8,000. And that just means any Medicare Advantage plan that has a contract cannot have a max out of pocket above what Medicare's regulated amount. And you have multiple plans to choose from per market, per county. So depending on the county you live in, it may be different than the plan with your friend that's in another plan right next to you. Next, we're going to cover hospital and cancer copay plans. Stick around, I'll be back in a second. All right, guys, let's cover hospital copay plans, or what I call cancer copay plans. These are two of the biggest factors that people usually kind of grimace at when it comes to Medicare Advantage plans, is the hospital copay. If you remember just a few minutes ago, we were talking about exactly what does it cost if I go in the hospital. That's going to range anywhere from $200 up to usually $350 copay cost day 1 through 6. And you're like, hey, if I stay 6 days, then I'm going to be paying out $1,200. And Kelby, I live on Social Security. Money comes in, money goes out, and there's like, $55 a month left over, or let's just be realistic, probably $150 left over. And I don't have $1,200 to pay if I go to the hospital. How do I ensure that liability or risk, or I just don't want to be out any money if something major happens like hospitalization or Part B chemotherapy and Part B radiation costs? That's going to be billed at a 20% billable rate up to your max out of pocket, what we call MOOP. So what happens in this consideration that your max out of pocket on your plan is $6,000 and you're getting radiation or chemo? Let's say if it's a $4,000 treatment and you're paying 20% of that, then you're going to be paying $800 every week. And it's not going to take very long to be able to hit this max out of pocket. Well, how do you ensure that? Well, it's very simple. You're going to buy what we call a copay plan. These copay plans never are more than usually $50 or $60 per month. If you are on a Medicare Advantage plan now and you don't have one of these, I would encourage you to call in, let us quote some plan options for you. It may be less. Typically, it's not anymore. And it goes with any Medicare Advantage plan. So whatever carrier you have, this copay plan attaches itself or follows along the Medicare Advantage plan. So if you go to the hospital, your cost is covered. If you have chemo and radiation or any form of cancer, this is going to pay out. Usually we do at least up to $7,500. That's going to pay out what we call a lifetime benefit option, in that if your max out of pocket for that year is $6,000, it's going to cover the cost of that and leave you with $1,500 over, which is always good, because guess what? If you're sick, you're going to and from, you're going to escalate costs when it comes to your food, gas, and things like that. So this covers and insures those risks. But if you go into the hospital, it's going to pay up to that copay amount. And normally we choose about $350 a day. And it's going to cover your hospital costs for the copays incurred by the Medicare Advantage plan. Plan cost yearly is about $660. So usually if you use the plan once every 2 years for something, or once every 3 to 4 years, depending on your situation, the plan pays for itself. You're really getting your money back. It's like investing in and getting back. And then this is what it really eliminates altogether if you have a Medicare Advantage plan, which is very important for any of us. None of us like to live under this thing called stress. And having money going out can be very stressful. This is an inexpensive way to insure your risk and eliminate the stress. All right, let's talk about a couple of examples of how hospital copay plans or cancer plans actually work for you and benefit you when it comes to a Medicare Advantage plan. And if you were going to choose just to be on original Medicare, you could use this as well, which I would not encourage you. If you talk to us, we'd put you on a Medicare Advantage plan or a Medicare supplement plan. But how does this work when it comes to a copay plan and when it comes to hospitalization? So as we've talked about previously, typical hospital copay is going to range from $200 a day up to $350 a day. Normally, most plans in a given market are 1 to 6 days. So you may have a plan that's 1 to 5 days. Again, that means day 1 that you're admitted up to, say, day 5 that you stay. This is the admittance. This is up to how many days you stay. Beyond that day, if you're consecutively in the hospital, say for 10 days, you're going to have zero cost beyond day 1 through 5 or 1 through 6, whatever your plan pays up to. So your copay, if it's $300 a day, you'd multiply that times up to the days that you stayed. So let's clean this and then just give an example that your copay cost is $300 a day. You're going to stay 5 days. So that means you would owe $1,500. This is going to cover all of Part A, which would be like deductible. Original Medicare is going to have deductibles. Part B services is going to cover 100% of that. That's going to be anything dealing with like specialist, tests, and etc. I mean, anything that falls under Part B services that would be a billed under original Medicare Part A and Part B services, this copay is going to cover 100% of everything. Now, you say, what do I do with this? This is where the hospital copay plan is going to come into effect. So if you're paying, let's say, $40 a month, typically what we would do is have a copay plan. Usually it's about $350 day 1 through 6. And this is how I like to be able to do it with clients that I talk to. You can do these all the way up to 10 days. But you're basically trying to cover and insure the risk that the Medicare Advantage plan does not cover. To simplify that, I like to just be able to use about $350 a day. So typically, most of the Medicare Advantage plans in our given market that we do with clients are about $300 to $350. So therefore, I use that $350 number, and then I do it up to 6 days. And that just means that if you stay 1 through 5, and that's what your plan is, and it's $300 a day, that's $1,500 a day. This premium that you pay monthly is going to cover your cost. How is that done? It's real simple. On a copay plan, you're going to have a submittal form that the carrier is going to ask you to submit. That's going to go to the carrier, and then they are going to pay that money out to you. So that money is going to come to you. You can use that plan, that money that you get paid, to pay the copays. Or honestly, you could take that money and spend it on a vacation. It's your money. So you pay for the policy. By paying that, you're going to submit it for a claim. They're going to pay out that money to you. And then you can take that and pay it towards a copay. Or again, if you have additional money above and beyond that covers the hospital copay, and you have additional money, it's your money to be able to spend it as you please. And then we're going to cover how cancer is covered with the copay plans as well. All right, so let's cover how the cancer benefit in a copay plan can cover you for max out of pocket. And this is important because most Medicare Advantage plans are going to have max out of pockets. Those are going to range anywhere from about $3,000 to $6,000. So if we just take an average in our market, that's going to be about $5,500. I'm going to use this $5,500 as an average. The max out of pocket is what you're going to be insuring with. So typical, like if you have a $40 premium, we normally are going to cover a hospital, plus we're going to have a cancer rider. So that may be, $40 to $55 a month in your costs, and it's going to insure all of these areas when it comes to hospital and cancer both. And then how this works is pretty simple in that if you get a cancer diagnosis, you're going to submit a form again. That form is going to go to the carrier that we have got you on. and that carrier is going to pay out, typically what we do, and what I like to do, is a $7,500 lifetime benefit. So that means it's going to pay out $7,500 to you. You're going to get this money to be able to spend towards your max or your costs dealing with copays or co-insurance dealing with the cancer diagnosis. So depending on what normally happens in this situation, somebody's going to have Part B, chemo or radiation. And with those, you're going to have high costs, several $100s per treatment. And then this is going to pay out to you, and you can take this money and be able to pay toward those treatments all the way up to your max out of pocket. Again, if your max out of pocket on your plan is $5,500 and your cancer copay plan pays you $7,500, then you're going to have a $2,000 amount left over. And this is where a lot of times people will take this money and apply it towards the gas, travel expenses. Maybe you have a sister or somebody's going to be coming in to help stay with you, and you want to be able to pay some of the travel costs of the airfare or gas or things like that for travel costs. Again, your max out of pocket would be met. And then on a lifetime benefit on copays, what that means is you're paid out the $7,500. And then over a lifetime, this begins to come back up. So if you have a reoccurrence and you fill that form and submit it to the carrier again, it's going to pay out that $7,500 over a period of time. So this starts going up. And then after a period of time, the plans are designed to be able to pay back out if you have a second diagnosis. And just to simplify this, we call these a lifetime benefit cancer copay plan. So hospital and cancer are two of the main major costs when it comes to Medicare Advantage plans. Again, a lot of times people will go into the hospital on an average nationally. About every 4 years, a person will go in the hospital an average of 2 days. So you may say, hey, I've not been in the hospital in 10 years. You may have somebody else that's gone in the hospital a couple of times for surgeries and things like that. The national average is about 2 days every 2 years. And then cancer, just to simplify this, I won't go into all the statistics, but about 1 in 2 people are going to experience cancer over a lifetime. So the cost for the plan is going to ensure the risk and the liability and the copay and co-insurance costs on a Medicare Advantage plan by adding this. So a lot of times people ask, when is a Medicare Advantage plan a great fit? I'm going to cover exactly what makes a Medicare Advantage plan a great fit. Again, one of the things I like to say is the golden handcuffs of Medicare, understanding that sometimes you're going to have an authorization that needs to be done from the doctor to the carrier, from you to the carrier, to have a process of things done. If somebody understands the rules behind Medicare Advantage plans, that what they require in each carrier, most of the time, the most complicated process of a Medicare Advantage plan is just understanding if a surgery is going to be scheduled. The doctor may say, hey, you need to have surgery, but the plan may say you need to have therapy, like physical therapy first, and then have the surgery done. Sometimes the doctor can just have the authorization waived as far as the therapy, putting in an appeal, just saying, hey, they can't do the therapy, here's why they have to have the surgery. But that's really the major component. And then some of the things here that if you understand the network, I'm going to cover how it works and then how to use the plan effectively if you understand how to use the plan. And that goes back to the agency or agent that you're dealing with. If you're dealing with an educated person that walks you through the process, lets you understand how the plan works, how to use the plan effectively, and then when you do have a problem, like for our office, our clients can call in, talk to our staff, and we can walk them through the customer service side of any plan option. Anything can have a problem. There's nothing that's perfect. So there's a process sometimes that you have to overcome with the original Medicare and a Medicare supplement, and also a Medicare Advantage or prescription drug plan. We would all love to be able to just hit the perfect, what I call the escape from reality button and just hit that and be able to eliminate any problems. But the reality is where there is people, there is problems, and sometimes somebody keystrokes in something wrong and it creates a problem, whether it be Medicare Advantage, original Medicare, Medicare supplements. Let's talk about why Medicare Advantage plans can be a great fit. One of the major things that I like to tell people, if you're in a metro area, we live in and around the Nashville market, so it's a metro area. So the Middle Tennessee area for us have great networks when it comes to Medicare Advantage plans. Now, that can be HMOs, which are going to have lower cost, and it can be PPOs, which typically are going to have a little bit higher copay cost. But both HMO and PPO plans here, are they perfect? No, but some of the major carriers here have great networks. So if you're looking at Medicare Advantage plans and you're in a metro area, it's safer to say the networks typically are going to be better. It's not always, but typically they are going to be better. One of the other things is zero to low premiums. A lot of times people want to be able to look at and say, hey, I don't pay a premium, and I don't want to pay anything unless I use the plan. So you have a zero premium for the Medicare Advantage plan. Your Part B, Medicare Part B has a premium, everybody pays. Right now that's $185. It goes up each year based on the cost of living adjustment. We call it the COLA. That happens across the board with Social Security. Medicare Part B, Part A and Part B deductibles and things like that are affected by cost of living adjustments. But you don't pay anything above and beyond the Part B premium. You have a zero or very low premium on Medicare Advantage plans. So when you access or use the plan, you have a small or low copay cost. And then if you do things like catastrophic events like being in the hospital for a long period of time, those typically are going to have a cap up to 5 or 6 days. You're going to pay $1,500 to $1,800 max amount, and then you're going to have a max out of pocket again for these. So out of pocket maximum is going to range anywhere from $3,000 to $6,000 yearly. So that's just being able to say, hey, the max amount I'm going to pay for access to Part A and Part B services is going to be up to this $3,000 to $6,000 amount. So it's kind of like, hey, I pay zero or very low premium. In our markets, most of the better plans are a zero premium. And then the max amount that I'm going to pay, let's say if it's $6,000 on your plan. So your risk goes up to $6,000. Again, we talk about copay plans that typically you can add alongside a Medicare Advantage plan. And this is going to cover the majority of the cost that this max out of pocket comes from is usually hospitalization and or like cancer type of diagnosis where there's Part B treatments of chemo or radiation. Now, one of the other big things is I want dental, hearing, vision, gym memberships, and the extra benefits the Medicare Advantage plans provide. These plans are going to provide a dollar amount, an allocated amount for dental, hearing, vision, a gym membership. Like for me, you guys hear me share my example, I pay $60 a month for my gym membership. Well, if you was on this and you went to a gym that participated, you'd have no cost out of pocket. So you would begin to say, how much does it cost me for dental, for hearing, for vision, for my gym membership? These are dollar amounts that you're saving because you have no cost to these when you enroll into a Medicare Advantage plan. So again, that's something to consider. You're okay with the rules of the plan and your doctor participating. So this is another thing when it comes to just coordination of care. Again, you guys hear me talk about kind of these golden handcuffs a lot of times, and these are just things like the plan requires certain prior authorizations to have services. You're going to have things like a network. And the reality is most of us have lived in a healthcare model for years where there's been networks. So this is not really a big change. For some reason in our industry, there's a lot of people that educate in our markets, like agents and agencies like myself, that will educate as if when you turn 65, it's like, oh, you never want to go on a Medicare Advantage plan because you don't want to be subject to a network or subject to rules and regulations around how the plan works. In reality is the employer-based plan that you've been in for years has had more strict network issues and rules and regulations as well. So when we go on to Medicare, if you're educated properly and you understand how the Medicare Advantage plan works, these plans can be a great fit. They're not the solve-all for everyone. You can enroll into original Medicare and a Medicare supplement and choose a prescription drug plan, but calling this like, hey, no one should ever enroll into a Medicare Advantage plan. It's just not how healthcare works. If you understand what you've been on, or maybe you've never had a health insurance before, now you're enrolling into for the first time of your life, having Medicare and enrolling into a plan option. These can be great plans if you understand how they work. The last thing is continuity and coordination of care. This is going to apply to people that have higher health risk, where the doctor, typically the specialist, and you are working together with the carrier of your choice when it comes to creating better coordinated care. And this is just making sure you're taking your medicine, making sure you're showing up at the doctor when you're supposed to, and getting the care that you need when it comes to longevity of life. So let's talk about Medicare supplements or Medigap plans. Also, you may hear these marketed as Part E. So you have A, B, C, D, and then you have Medicare supplements, which can be referred to as a Plan E. So what about these plans do you need to know? One, you have to have Medicare Part A and you have to have Medicare Part B to enroll into a Medicare supplement plan. So you have to have both parts of Medicare. Part A is hospital again, Part B is medical, and then to enroll into a Medicare supplement plan. One of the main things I like to tell people about Medicare supplements is there's really 3 or 4 different options that people look at. One, most people, if your birth date is prior to January 1st, 2020, MACRA, one of the rules, if your 65th birthday was prior to this date, you can still qualify if you so choose to enroll into a Medicare Supplement Plan F. That became what's considered as the guaranteed issue plan. So if you were coming off an employer-based plan, and if you're still working, you'd have to be 78 years of age or older, but like if you're still working and you come off and you're going on to Medicare, original Medicare, and you're going to enroll into a Medicare supplement, and your age requires this of you, you're going to still enroll and be required to go into a Plan F as a guaranteed issue. Or if you're like, I don't want to do an F because of the premium, which I'll talk about here in a second, what's happened with the market, the premiums on Plan Fs have gone up. And this is all designed because of legislation that was passed, requiring from 1/1 of 2020 and beyond. Now the new guaranteed issue is a Plan G. So what that means is if you're turning 65 and you're working out here until you're 68 years of age, and you're coming off and going on original Medicare A and B, and you're going to enroll into a Medicare supplement plan, and you're like, what's my guaranteed issue plan now? That would be a Plan G. Now, what if you're like, hey, I don't want to go on an F or a G. The F is not available for anybody from 1/1/2025 and beyond. The G is available. The F has not gone away, as I just explained. It's just not available for anybody turning 65, from 1/1/2020. You would look at a guaranteed issue of G, or you have other options up to the plans available. But usually what most of the clients are looking at now is a G and or an N. An N is going to have copay cost to access when you go to the doctor of $20. If you go to an emergency room visit, you're going to have a copay up to $50. And then the other big thing with the Plan N is you're going to have excess charges of up to 15% of the cost. And this is going to apply to any doctor that typically does not take original Medicare for fee-for-service, but they will process your claim. So if you go to a doctor that typically doesn't take original Medicare, but they'll process your Medicare claim, they are typically going to charge you this excess charge of up to 15% in addition to what the fee schedule is for Medicare. So the easiest way to be able to explain that is if you go to a doctor visit and it's going to be a $100 fee, if it's going to be a $100 fee for service for Medicare, and you get added 15% of that, you're going to owe $115 for that doctor visit. So this applies a lot of times to this Plan N, which is an option because the plan in, because you are participating in cost of $20 or $50 for ER, and then you have the percentage of up to 15%, plus you're going to continue to pay a Part B deductible for whatever that Part B deductible is for that year. You're going to be paying this cost. What it's going to do is lower the premium for this Medicare supplement plan in, if you so choose. So my thought on this is, if you want to have original Medicare because you're like, hey, I want to have access to any doctor, any hospital, anywhere, and I live in a rural area, but I want to have a lower premium cost than a Plan G. So Plan G is going to have a higher premium cost, but you're like, hey, I want to have a smaller premium cost, and I'm willing to take on some of the Part B fees, which again is going to be the deductible, and then, you know, a couple of copay things that are going on, and you may be charged a fee for excess charges. If this is your situation, you are going to pay less premium with a little bit of exposure and cost, and a plan in can be a great option when it comes to that. All right, let's look at some things about the Medicare supplement and also why sometimes it's a great fit. One, your average premium is usually going to run roughly around $130. Now, for you guys that are females, females are going to have a lower premium cost. So if a male is $130 on cost, the female may be showing up at like $110. So females are going to have a lower cost. The male is going to have a higher premium cost. Premiums increase yearly always. Single-digit rate increases up to 18%. Now, this kind of gets me into a little bit of educational point on this. Premiums are going to increase yearly, and then some carriers, there are carriers out there that are going to have double-digit rate increases, and they're popular. If I said one of the carriers, everyone that was watching this will be like, oh yeah, I've heard of that company before. What we do is we actually have a software platform that we put your information in based on the information that we had to gather for Medicare supplements. And then we are able to look at the different Medicare supplement plans that are available to you. And we are looking for plans that have suppressed rate increases of single digits. So single digit increases is what we're looking for. So we're looking for a carrier that's going to have a stable over a long period of time. Usually we're looking at about 5 to 7 years. What has that carrier done historically? Now, we can look at history, but none of us can look into the future, okay? So we can look at history up to 5 to 7 years and say this carrier has had single-digit rate increases. What we don't have is a crystal ball to be able to say, hey, this is what's going to happen in the future, because this is based on the insurance carrier. But we're going to look at premium options based on the plan, and like a Plan G or a Plan F or a Plan N or any plan that you choose, they're all standardized. So a Plan G is going to perform exactly the same across all Medicare supplement plans. So if you do a G, it doesn't matter what the carrier is. What you need to have is an educational approach to understanding how the plan works, and then an expert at looking at the data there of what's happened in the past for that carrier. And then another significant thing to always consider, and this is sad to say that a lot of times new agents and agents sell based on premium. You know, premium is not the only factor. We're going to look at the history, and then also we do not take new carriers in a market and write our clients on new carriers. New carriers sometimes will have lower suppressed premiums because they're trying to block out this book of business and have new clients. And then what happens? Well, the increases sometimes end up being double digit. And so we do not like to promote and market new plans in a market. So if it's a new carrier, ABC company, and they don't have the history of enough enrollees based in that plan, we typically are not going to talk to you about that, because we're going to tell you that's a high risk because you have no history data of what the suppression of the premium and things like that as far as going on with Medicare supplements would be. Plan G, typically most of the people that we've enrolled historically have been in a Plan G. You just pay the Part B deductible only. This goes up every year. This is 2024, so this would go up every year. Again, what causes this to go up? The cost of a living adjustment called COLA is going to make that Part B deductible go up. So again, this is 2024 and 2025, it has gone up. No network, anyone that takes original Medicare you can take original Medicare, show your Medicare red, white, and blue card, and then it's going to bill your Medicare supplement to pick up the additional cost. So the additional cost that Medicare does not cover, the Medicare supplement is going to pick that up. No cost beyond the Part B deductible for a Plan G. Again, we talked about a Plan N, but for Plan G, to keep this simple, you pay your Part B deductible for that year, and 100% of everything else for Part A and Part B services are covered. Now, one of the big things that we talk about with Medicare Advantage plans, Medicare Advantage plans do offer dental, vision, hearing, vision, and things like that. The Medicare supplement plans, the Medigap plans, are not going to have these benefits built into the plan. So if you're looking for dental, for hearing, for vision, over-the-counter or gym memberships, Medicare Advantage plans are going to have those. If you're wanting to be able to add, you can add for a premium amount. We do dental, hearing, and vision plans. Over-the-counter is a benefit that Medicare Advantage plans have. Gym memberships, there are a few Medicare supplement plans that provide this. Sometimes the premium cost doesn't outweigh or the cost for increase for like the rate increases and things. This is something we can look at and educate you on. But some plans, a few of them, do have a gym membership built into the plans. And again, most popular plan for us has been the Plan G. Again, going back to the January 1st, 2020, prior to January 1st, 2020, coming up to the time frame that we're in right now in 2025. Just understanding that some plans have not gone away, but you can enroll into a Plan F if your 65th birthday has been January 1st from 2025 up to the current date. So what is the key to enrolling into a Medicare supplement, and when is a Medicare supplement a great plan fit? Well, you want to budget a monthly amount for medical costs. So like, hey, I like to pay a premium and not have any additional costs like copay, or what if I go to the doctor, I don't want to keep up with all that. I just want to have a premium and not have any additional costs. Traveling, you may need to see a doctor away from home, or you live in Florida for 6 months and you live in Tennessee for 6 months. You're going to be accessing care in both places, seeing doctors, specialists, maybe a surgery in Florida. You have somebody down there that you see for certain health conditions, but you travel, or you want to travel outside of the network area that you live in, go into another state. My mother lives in one state in Kentucky and comes into Tennessee getting care all the time. So I have her on a Medicare supplement plan with a drug plan, which we'll talk about in just a second. The reason being is she travels out of the state into another state, and having her on a Medicare Advantage plan would create complications for her. With original Medicare and a Medicare supplement, she can travel outside of her state and get access to care. She can see, or you can see, any doctor or specialist anywhere. If they accept original Medicare, plans pay or help pay some of the healthcare costs. Typically, again, we're talking about small amounts of money that the Medicare supplement plan may have, like a Plan G is the deductible. Plan N is the deductible with the small copay costs that go along with that. You don't mind paying for dental, hearing, vision, and other benefits. So you're like, hey, I want a Medicare supplement, but I also want to have dental, hearing, vision insurance. What does that cost for me? Which we'll talk about in just a few minutes, just as a reminder. But typically, time you add on additional benefits like this, you're going to pay anywhere from about $30 up to about $60 in coverage, depending on what type of benefit you want. If you're just wanting dental, it may be a little less. If you want a plan that covers dental, hearing, and vision. Anyway, those are ancillary products that can be not added to the supplement, but purchased separate and apart from your Medicare supplement to cover and insure those. So if you don't mind paying for those, Medicare supplements are a great plan fit as well. And so always remember this: if you're doing a supplement, you need to add a prescription drug plan because of the risk and liability. Even if you don't take any medication, the premiums for Medicare prescription drug plans can be very low in premium cost, and they're based on your formulary need. If you have medication or if you don't have medication, having this eliminates you from being penalized on the Part D coverage. Starting in 2006, they began a Medicare penalty for prescription drug plans. If you don't take the plan, you're going to have a 1% towards the national prescription premium average, which ranges anywhere from about $35 to about $42, $47 a year. So it's about 35 cents to 42 cents, 47 cents accrued penalty that's going to add up monthly. So if you go 36 months without a prescription drug plan, then you add it, you're going to have 36 months of penalty that adds up. So after several years, a lot of times people say, hey, I don't have any medication needs, I'm not going to do a drug plan, and I'm not going to have anything come up, I'll just take generics. Well, the reality is with certain health conditions, you can't, again, you don't have a crystal ball. You can't look into the future and say, I'm not going to ever be chronically ill. My own father passed away 6 years ago. Had great health up to 58 years of age, and then he was diagnosed with COPD. And then he went on multiple inhalers, and my dad maintained his health as well as he could, but over a 20-year period of time, his health declined and got worse and worse, and his medication increased. Even though he came off of some medications, he did some chiropractic care and some things like that, came off blood pressure, cholesterol medication. He was always on oxygen, and he got to a point of 100% oxygen, and he got to a point where he was on breathers and inhalers to allow his lungs to function where he could actually have somewhat of a daily life. And my dad didn't have a lot of things he could do in the last few years of his life because of the severity of his disease. But nowhere along the line in his 40s and 50s would he have ever thought, hey, I'm going to have a chronic illness that's going to end up taking my life at 78 years of age. So he died at 78. You, along with me, we don't know what's going to happen tomorrow. My encouragement would be, based on most people, they're going to be prescribed some form of medication at some given point. And if that's a name brand drug, it can cost several $100s, and you can eliminate that risk by just adding a prescription drug plan. Some of these plans have deductibles. They range up to the yearly deductible set by Medicare. Right now, that's $590. Some of them don't have a deductible, and we get into some of this detail in other videos and things that we're doing. So I would encourage you, if you do original Medicare and you're going to have a Medicare supplement, to always add a prescription drug plan just to be safe in case you are prescribed a medication. And for you guys that are on medications, you know, hey, the drug plan reduces drastically the cost of medication cost. And now with the Inflation Reduction Act, the highest amount you're going to pay towards medication that we talk about with videos dealing with the Inflation Reduction Act is up to a $2,000 max out of pocket for the year. And that started this year, January 1st of 2025 and moving forward. So if you do have questions about the prescription drug plan and you don't have a licensed agent, I would encourage you guys to be able to call, ask questions, get informed, get educated, get guided through the process, and then finding something that's inexpensive for you if you don't take medication, or what's best for you if you take a lot of medication, because this all is determined by the formulary and what area of the U.S. that you live in. Guys, if you have additional questions about Medicare, and you're like, Kelby, you're diving into a lot of things, but I want to have like a guidebook and a video and I can watch it at my own pace, I would encourage you to click below. You can register for one of our Medicare Made Simple workshops. They're on demand or live. They have a guidebook that's provided. It's me walking you through everything that you need to know about Medicare and so much more. Register below, and if you haven't taken the time to like, subscribe, hit the bell icon, we'd love you to be able to follow us on YouTube, get notified every time I put out content like this that helps you save money and allows you to be able to simplify the processes of Medicare, or as we like to say, to make your life easy by making Medicare simple. We'll talk to you in the next video.